Hello and welcome to another Piper Pearl. Today's Pearl will be looking at cervical lymphadenopathy examination. So the reason we're looking at this particular examination is it's very rare for a patient to note enlarged lymph nodes and present to you with that as the chief complaint of a swollen gland or have a knot. It's more commonly the patients don't actually recognize they have an enlarged lymph node, and lymphadenopathy is discovered by the actual examination. So since lymphadenopathy can be associated with a very wide range of disorders, spanning from benign medical problems like a viral infection, it can also be caused by streptococci, and then it can be even malignancies. So the discovery of an enlarged lymph node represents a very important clinical investigation tool that demands a systematic evaluation. So I spent a bit of time just looking at the lymph nodes themselves. Most people aren't aware that there are over 500 lymph nodes gathered in various areas of grouping throughout the body. Now, these nodes represent an integral path of both immunological and something known as the reticuloendothelial system. Now, individual lymph nodes consist of lymphocytes clustered in lymphoid follicles and reticuloendothelial cells themselves, which are known as nodule sinuses. Now, each follicle contains a germinal central population of rapidly proliferating B cells and macrophages. So these germinal centers are surrounded by densely packed areas of smaller lymphocytic T cells, and these replicate at a much slower rate. So both the B and the T cells function in the recognition and response to any antigen that stimulates the body. And it's the B cells, as we know, that is principals for the effector cells of the humoral arm of the immune system, whereas the T cell really helps out as a principal enforcer cell of the cellular arm of the immune system. We all know the good old macrophages and cells of this reticuloendothelial system. They also play a very strong role in the immunological system. The function of phagocytosis and cellular debris and foreign body pickup, viruses and bacteria also all gather in this node in an area being drained into the system. Now, the enlargement of lymph nodes can be caused by a number of reasons. Whether it's localized or generalized enlargement, it can be the consequence of a series of different pathological responses. So one of those is simply an increase in size of lymphoid follicles and proliferation of your lymphocytes that we just spoke about in a response to a new antigen. So it means that if you have an antigen, being an infection most of the time, then the lymph nodes can increase. But they can also enlarge with the infiltration of other cells that are not supposed to be there. And this is where our metastatic tumors come into play. So when we're getting ready for our examination and we're moving into it, we need to give rise to what we just spoke about and look at the reasons why lymphadenopathy occurs. So when we're going through a differential diagnosis, it can involve a spectrum of infectious disorders, immunological conditions, malignant processes, storage disease problems, and various other disorders that can come into play. So we start with clinical history. So clinical history is absolutely vital in helping out the diagnostic management. And sometimes we don't actually need anything greater than clinical history and a quick lymphadenopathy exam to diagnose the patient. So it can help rule out a lot of unnecessary diagnostic tests. Now, the age of the patient is also very, very important because growth enlargement of the lymph nodes and the lymphoid tissue, like your tonsils and your adenoids, is quite common in children as a response to a weak antigenic stimulation. So you only need a small stimulus from an antigen as a child, from a bacteria or a virus, to get lymphadenopathy. Whereas adults, the same level of antigen exposure doesn't actually elicit as much lymphadenopathy. Now, when you're doing your examination, it's very important to pay attention to the characteristics of the actual glands. So we look at where they are, the size of them, the shape of them, the consistency. So we're looking at smoothness, roughness, form borders, that sort of thing. How much they move can be a good indication, and also tenderness can let us know things like inflammation. Another thing to look at is if you feel lymphadenopathy, just have a closer look at the skin, because if the skin is discolored, it actually means the lymph gland itself is disproportionately large. So we're not talking normal inflammation due to infection exposure, because that's supposed to happen. We're talking about a significant enlargement that is actually causing a decrease or an alteration in circulation on the skin. So it can be a really good indication of that. There also can be associated cellulitis from a very infected lymph gland itself. So when we're feeling the lymph glands, general characteristics of those lymph glands can mean different things. So if you have a smooth, soft, slightly enlarged lymph gland, this is normal physiological response to cleaning up. Okay, cleaning up viruses, cleaning up bacteria doesn't actually mean that they have an active infection if it's just slightly enlarged with smooth, soft edges. Now, if they are very much enlarged with irregular shape and they feel almost rubbery, then that's an indication for referral, because it can mean malignant involvement. So if the cells that aren't supposed to be there move in, they can form in particular areas on the lymph gland and then start to multiply within the lymph gland itself. So the node is not functioning normally, which means you'll have an irregular shape. As I mentioned, if you're palpating and it's tender, it can be involved in an inflammatory process. If they're a matted or a fixed nodule, again, we're looking at a difference between a good infection and malignancy. If the lymph gland is palpable but freely movable, it can often link to just a benign condition like a virus or bacteria cleanup, that sort of thing. So let's have a closer look at the location. So where to find these lymph glands and what it actually means for those regions to be inflamed. So we'll start with the anterior cervical lymph glands. Now these are both superficial and deep lymph nodes themselves. And the nodes lie on both the top and beneath the sternocleidomastoid muscle on either side of the neck, from the angle of the jaw to the top of the clavicle. So obviously the sternocleidomastoid muscle allows the head to turn to the right and the left. So when you're examining, you can get them to turn their head to make it a little bit easier. So when you're looking at the anterior cervical lymph nodes, just realize that the drainage areas for these lymph nodes involves the internal structures of the throat, as well as the posterior pharynx, tonsil, and thyroid gland. When we move back to the posterior cervical glands, they extend in line with the posterior angle to the sternocleidomastoid muscle, but in front of the trapezium itself. So you can palpate the Lars muscles to help find them. Drainage for these areas is often associated with the back of the head, but it's also frequently enlarged due to upper respiratory tract infections, in particular mononucleosis or glandular fever, which is the same thing, just different name. The tonsillar lymph gland is located just below the angle of the mandible, and the drainage comes from the tonsillar area, obviously, and the posterior pharyngeal region. So you can get swelling there and the anterior cervical region at the same time. Submandibular gland is alongside the underside of the jaw, and this drainage is from the floor of the mouth. Now remember that there is the submandibular salivary gland there as well, so you can mistake those. If it's a large mass, it's often the salivary gland, because those glands are quite small. As too is the submental, which is just below the chin. The drainage of that comes from the teeth and the oral cavity. There's also a larger salivary gland there. Now the supraclavicular glands, they're in the hollows of the clavicle, just lateral to where your sternal notch is. Now the drainage for these comes from the thoracic cavity and the abdomen itself. And when conducting the exam, it's good to have a systematic approach. So I'll go through a general systematic approach, but you can come up with your own if you want to. It's just a matter of practicing. So start under the chin, which is the submental lymph node. Then move posteriorly palpating beneath the mandible, finding that submandibular gland. Now turn upwards, if you will, at an angle of the mandible, where you'll find the tonsillar, and you can also find the parotid lymph nodes itself, which is just at the base of the ear. From there, feel the anterior or the pre-ornical lymph nodes in front of the ear, and then move around the back of the ear to feel the posterior ornical lymph node itself. From there, follow the anterior border of that sternocleidomastoid muscle in order to feel the more superficial anterior lymph glands. Move down to the clavicle and then palpate just behind the sternocleidomastoid for the posterior cervical chain to the mastoid process itself. Palpate over the occipital region to find those occipital lymph nodes, and then ask the patient to turn their head, basically bringing their ear toward their shoulder on each side, and palpate behind the posterior border of the clavicle and the supraclavicular fossa in order to find the rest of those deeper anterior lymph nodes and to get a better feel of the supraclavicular. Okay, so that ends the lesson on cervical lymphadenopathy examination. It's a good trick to have in the field or in general practice in order to really know what you're feeling for and realize where the lymph nodes sit and the areas that generally they drain from in order to pinpoint down what sort of pathophysiological response or process the patient is going through. But until next time, take care.